Well, there is an alarming gap in life expectancy in central Indiana. Residents in Fishers live 17 years longer than Hoosiers who live less than 20 miles away in one of the most disadvantaged areas in Indianapolis. It's a stat that inspired Eli Lilly and Company to invest even more in its hometown. And Business of Health reporter KYLIE VELETA has more. KYLIE.
Well, thank you, Gary. Just a few years ago, the life expectancy gap was 14 years between neighborhoods in Indy's urban core compared to the northern suburb of Fishers. That's when Lilly invested $7 million to launch the Diabetes Impact Project, because these neighborhoods of color also have higher rates of diabetes. Then a report in August showed the life expectancy gap had grown even wider, now to 17 years. It inspired Lilly to get even more aggressive and invest an extra $5 million in the Diabetes Impact Project. Joining me now to tell us how Lilly is expanding their work is Courtney Roberts, Director of Global Health Equity Partnerships at Lilly. Hi, Courtney. Thanks for being on the show today.
Hi, KYLIE. Thanks for having me.
Well, let's start with the Diabetes Impact Project. It got underway in 2018. Just give us an overview of what the project is.
The Diabetes Impact Project Indianapolis Neighborhoods, also known as DIPIN, is a partnership to address diabetes in 3 Indianapolis neighborhoods where life expectancy is among the lowest in the city, where 83% of residents are people of color, and where diabetes rates are nearing 20%, which is almost twice the national average. It was initially launched in 2018 with the mantra, "Where you live should determine how long you live," in response to the life expectancy study by Fairbanks School of Public Health that Gary just referenced. That data showed us that there was a life expectancy gap of 14 years between the northern suburbs of the city and the urban core of the city. And some zip codes right here in this city had the life expectancy of Iraq and Uzbekistan. So by addressing diabetes in some of these communities, which is where Lilly has deep expertise, we felt like we could play a role in closing that gap. DIPIN is a multifaceted partnership led by the 3 communities in themselves in the city of Indianapolis. It provides a holistic approach to diabetes prevention and control that includes neighborhood residents as well as community health workers.
So Lilly has really intensified its efforts now, investing an extra $5 million in the project. A lot has changed since 2018 when this project started. So explain why Lilly wanted to reinvest in it.
This investment makes sense right at this particular moment in time for a few reasons, KYLIE. First, the updated data that the life expectancy gap has widened even further from 14 years when we launched the partnership now to 17 years. According to this data, people in the DIPIN neighborhoods can expect to live nearly 17 years less than people who live 20 miles north. And secondly, our decision to reinvest was also influenced by COVID, which has only illuminated health disparities. We know that people of color are experiencing a higher burden of cases, hospitalizations, and deaths. We know that people with underlying medical conditions like diabetes are more likely to have serious complications from COVID. And while we don't yet know the impact of COVID on life expectancy in these communities, we can only guess that it's likely to widen given what we know about the virus. And third, changing the health of an entire community takes time. This is not just an extended investment in funding. It's also an extended investment of time. And health inequities didn't occur overnight. And turning the tide on that doesn't happen overnight either. This new investment is crucial to achieving long-term, sustainable, community-level change.
And really at the heart of the change is Lilly's focusing on social determinants of health. Can you explain how this program really gets at the heart of the social determinants of health?
Social determinants of health are the conditions of a person's life, the conditions where they live and work and learn, and they affect both health and quality of life. Social determinants of health are at the center of this work. We cannot address diabetes without also addressing those issues that our neighbors worry about every single day. Lack of access to fresh food, safety, economic security. These issues contribute to diabetes and impact a person's ability to manage diabetes. A major focus of this next phase of this partnership will be on social determinants of health. The residents of these neighborhoods will look at tackling barriers of food access, stress and mental health, as well as opportunities and access to physical activity.
And just I'm sorry, go ahead. You go ahead.
And because of this focus, this work actually has the potential to impact every single resident of these communities, whether they have diabetes or not. And we know that we can't change the health of these communities without also addressing the totality of people's lives.
And only about 20 seconds left, but I want you to mention the community health workers, how they're embedded in the neighborhood. Can you explain how they help guide some of the change?
Yes, we listen to and trust those closest to us, our neighbors, our faith leaders, our friends, and this is where the community health worker comes in. The community health worker isn't a doctor or a nurse. They're someone who lives in the community, who makes door-to-door visits to neighborhood residents. They know the barriers and worries that the residents face. And over the last 2 years, community health workers have been embedded into these neighborhoods. And while much of that work is focused on diabetes treatment and prevention, the community health workers are also helping individuals living with diabetes address those social determinants of health that might be contributing to their diabetes.
All right, Courtney, thanks for sharing more about the program. Good luck moving forward.
Thanks, Kylie.
Gary, back to you.